The standard treatment for grade 1 or grade 2 non-functional and unresectable gastrointestinal pancreatic neuroendocrine tumor is monotherapy with somatostatin analog or molecular target therapy like everolimus. However, there is a poor prognostic for population patient such as Ki67 more than 5% or liver diffuse metastasis patient. For that aggressive patient, the somatostatin analog or molecular target monotherapy is not so good PFS. For example, Everolimus monotherapy provide a limited PFS of around 11 months. So that remains a necessity for better therapeutic approaches. So that is why we evaluate the combination therapy of everolimus plus lanreotide for like this poor prognostic GEP-NET patients. Our study is named the StarterNet. StarterNet trial was a randomized phase 3 trial to evaluate the efficacy of the combination everolimus plus lanreotide for the first-line setting. The main inclusion criteria was histologically proven G1, G2 GEP-NET, non-functioning, and undetectable recurrent disease. Here, 67, 5 to 20%, or less diffuse liver metastasis patient, and no prior treatment patient. We randomized the patient everolimus arm and everolimus plus lanreotide arm one by one. The primary endpoint was PFS, and key secondary endpoint was OS, and the other secondary endpoint was ORR and DCR and safety. Our main findings was the combination therapy of everolimus plus lanreotide was significantly prolonged PFS. The median PFS of everolimus arm was only 11.5 months. However, the combination therapies median PFS was 29.7 months. With a hazard ratio was 0.38. So our study was terminated early due to efficacy. And as for the overall survival, the median overall survival was not reached in both arms with hazard ratio 0.74. However, the combination therapy of everolimus plus lanreotide was a consistently better result in both PFS and OS. And also the ORR, objective response rate, was of the everolimus plus lanreotide arm was significantly greater at 23%. Compared with the everolimus arm at 8.3%. As for the adverse event, slightly the higher adverse event occur in the everolimus plus lanreotide arm at 35.6%, compared with the everolimus arm 40 plus 9%. However, the most adverse event was well tolerated. And the most highly shown the adverse event in everolimus plus lanreotide arm was hyperglycemia. It is easily manageable. From this result, we could say this combination therapy, everolimus plus lanreotide, it can be a new standard first-line setting. for the patient with the GIG2 GEP-NET with poor prognostic factor. Especially from the subgroup analysis, the combination therapy's efficacy is higher in the more than Ki67 10% group. So I would like to say the more aggressive G1, G2 GEP-NET is recommended to use the combination therapy. In the future, we would like to compare the PRRT study. PRRT is recently the good result from the NETTA2 trial. Also, from the NETTA2 trial, median PFS over PRRT is around 30 months. Compare with our result. So we would like to, in the future, to make a clinical trial, head-to-head clinical trial, Everolimus plus lanreotide versus a PRRT, for the patient with a Ki67, 10 to 55%.